So say you were invited into a practice to improve their post-op complication rate. What would be your top tips for that?
So firstly, you can't improve unless you know how you're doing already. So that's like where you do sort of like your own benchmarking audit. So in a month, or you could just do 2 weeks to start with if you wanted to. Every patient that comes back to the practice, you could either set up a questionnaire or just have a very simple scoring system, like the using the RCVS knowledge clinical audit template, which you can download, and just recording it. And then at the end of the 2 weeks, look at what your complication rate is, and then have a chat and think about, what's influencing this. Oh, well, on the clinical notes, it actually said that the owner wasn't given a buster collar, or refused it, or owner said let off lead on the second day. So then you can start thinking about, well, how can we communicate better with the owners? What advice are we giving? Is everyone giving the same advice? And then making a few adaptations, and then re-auditing and seeing if you make improvements month to month. And in my practice, normally I would audit, I think, about 200 patients a month that were just having neutering before I started auditing everybody, which was then like 400 animals, which is a lot. And then again, as I say, just like looking at, well, what was going wrong really, and how we can make things better. And then once you start engaging the team, saying, oh, did you know that dog castrate, that you saw this happened, and then we've changed this, and this month we've only had 5% complication rate versus 15%. I'll be like, wow, that's really, really cool. And I find that sort of telling everyone the results, some months aren't as good, don't get me wrong, like you do have months which are worse than the month before, but then it's thinking like, what's different this month? And sometimes it's as simple as the weather. If you have a really wet month and they're taking their dog castrates post-op out for walks, and all that mud is splashing up on the castrate wound. Well, is that an influencing factor? Possibly. So if I was going to go into a practice, I would say do a benchmark audit, have a team meeting. How does everyone think they're doing? And a discussion for change, and involve everybody that's involved in sort of giving owners advice and looking after the animals in the practice as well. Because it's a team approach.